Hi, my name is Laurie Pepin. In my practice as an oncology physical therapist, I've worked with hundreds of women who've undergone cancer treatment. I understand this can be a scary time for you, as you don't know what to expect. We hope these videos can help answer some of your questions. I want to emphasize the information we're presenting is general and should apply to many of you. However, each person in surgery is unique, and you may receive instructions from your doctors that differ slightly depending on the specifics of your case. First and foremost, you want to get lots of rest after surgery. If you have younger children, try to make arrangements for help with childcare. Getting enough rest does not necessarily mean staying in bed all day, but do avoid strenuous housework, cooking and cleaning for the first 2 weeks. When you are laying down, the most comfortable position will probably be on your back with a pillow underneath the affected arm and a pillow underneath your knees. Again, it is important to move around your house as that gets your blood flowing and can prevent blood clots. We recommend walking around the house for 5 to 10 minutes at a time, at least 2 to 3 times a day for the first 2 weeks. A second important thing is to take care of swelling. It's normal to have swelling after any surgery, and for many of you, this is probably your first surgery. When you wake up from your surgery, you will most likely have small tubes coming from your chest wall to help drain the excess fluid. This is especially true if you've had a mastectomy. Your doctors and nurses will show you how to take care of these, and these will stay in for 10 to 14 days on average. It is important to let your surgeon know if you start to have unusual buildup of swelling in any area, or if you have redness, tenderness, or fever, as these could be signs of an infection and may require further treatment by your doctor. It is okay to use the affected side to dress yourself, brush your teeth, eat a meal, and do light self-care. You may initially need some help to shower if you have drains until you figure out how to maneuver around them in the best way. Your nurses may have some practical tips to help you with this. It is okay to use the affected. Wear upper body clothing that's easy to get on and off, and that does not involve pulling it over your head. This could be anything that wraps around your shoulders, a shirt that has buttons on it, or a loose dress that you can step into. It's also okay to lift up to 1 to 2 pounds, such as plates or a cup of tea. In the metric system, this translates to 1 to 2 pounds or half to 3/4 of a kilo. It's also okay what to avoid. Avoid lifting heavy pots, pans, or dishes. Avoid sweeping, vacuuming, or scrubbing. These are all general restrictions for the first 2 weeks. Depending on the type of surgery you had and how you're recovering, all of these restrictions will gradually be eased over the next 6 weeks or so. To help you out more, here are some specific movements and exercises you can do during this same time period. To help